at 25 minutes past 9. Of course, you are on the Breakfast Club, and right now we're looking at it's Thursdays. You know, Thursdays we talk about health matters. We look at mental health matters as well. But today we're looking at one specific thing, which is epilepsy, because November is World Epilepsy Awareness Month, and the theme for this year is the epilepsy journey, emphasizing on personal stories, access to care, inclusion, and lived experiences. In studio, we do have Blessed Alubisia. She is a neurophysiologist, if I said it correct, and then also Fredrick Beuchi.
Yes.
He is an epilepsy awareness ambassador. Good morning.
Good morning.
How are you doing?
You're doing well.
Karibu sana.
Asante.
Thank you for yes.
We really appreciate the opportunity today.
Yes.
Being November Epilepsy Awareness Month, to really be here and raise awareness about epilepsy.
Yes.
Yes.
Fredrick, why is it important to raise awareness about epilepsy?
Well, for me, my journey of raising awareness started way back in 2013. Apart from being very enthusiastic about raising awareness, I am also a caregiver.
Okay.
I have a sister who was diagnosed with epilepsy when she was 2 years old. She's now 20 years old, and she's been doing so well because she's been in the journey of treatment now for a long time. And being 20 years, she's now been seizure free for about 7 years. Yes. And perhaps at some point Dr. will talk about what being seizure free means.
Yes.
Yeah. But in layman's language is she was getting like drop attacks after every like 20 minutes. And so when we talk about being seizure free, it means she has not been getting the attacks for that period of time. So that is where my journey of really raising awareness started, because now I was looking at if this is what my sister had to experience by the time she got an opportunity to get a doctor, be put on the right treatment. What about so many other people who have been barred by the fact that they don't have information about what epilepsy is all about? It is a condition that has been shrouded around with a lot of myths, misconception, and all this has been because of lack of information. Actually, people not understanding or knowing what epilepsy is. And maybe today we will get to know like what epilepsy is, what causes epilepsy, so that we can now begin to remove all those misconception about people saying epilepsy is caused by demon possession, or it is a curse from God. For the believers, I like giving this example from the story of Jesus. At some point he heals a young man with epilepsy, but if you read it, it says when that young man was brought to Jesus, the shadow of Jesus, when it was cast over the boy, the demon of epilepsy left the boy. So you have people today still believing that epilepsy is because of demon possession. They are professional, they are people who are learned, but just because there's this aspect of faith that was mentioned in the holy book, they take that. If you begin to explain to them it's a medical condition, they start telling you, no, you don't understand, you should take this person for prayers and so many other things. Yes.
Fredrick, in your experience being with your sister, since she was diagnosed at 2 years, and now she's at 20, what do you feel that was missing in terms of the society understanding what epilepsy is?
Actually, it's the gap of information. Because from where I come from, I only knew of one person who had epilepsy, and he was known all over the village. So by the time we go to the hospital and our sister is diagnosed with this condition, people could not believe. Actually, they started saying that probably we have done something to our sister so that she has that kind of condition, so that we can benefit in one way or another. So it was a whole gap of lack of information, like people not understanding or knowing what epilepsy is all about. And that lack of information was also being caused by the fact that it is a condition that people don't like speaking about, because they always see it as, if this is in one family, then it means in their generation there must have been this kind of condition. So it's like that whole generation is either cursed or something. So there would be, I came to realize actually it was not that one person that we knew about. There were so many, but they were locked in, because there is no family that wanted their son or daughter to be known that they have epilepsy. So they will be locked in. They will not be given opportunities to live a life just like any other, until we came out as a family and started talking about it openly. Then people started realizing, oh, so this is a medical condition that, you know, can be treated, can be managed, and so we should just get our people out and take them to the hospital.
And what challenge did your family experience through this?
Wow. Now that we are, you know, Christians, we belong to a Christian community, the fact that even from the church point of view, at that point in time, I was a leader for the youth. My father was at the church chairperson, and we first experienced being sidelined because people wanted answers as to why, after all these many years within our village, we have not heard about any other family having this kind of condition, and it's you. The other thing was about now finding even an opportunity for our sister to go to school. You take her to school, but the moment you mention to the teacher that she has epilepsy, they all go like, she's going to be a little bit of a problem to our pupils or students here, because we can't imagine every time she gets a seizure what will happen to the rest of the kids. And also the notion that when she gets that seizure, whatever happens at that time, anyone who touches her, then they end up getting what? Epilepsy, you see. So all these things really were very difficult for us as a family to handle. And I think that is what pushed me to want to tell people that epilepsy is not contagious. Nobody can be having a seizure and you touch them and then you also get. So we had to demystify all those myths and misconceptions within the community.
All right. Thank you so much for sharing that, Fredrick. Blessed.
Yes.
You are a neurophysiologist.
Yes.
First of all, what do you do?
Thank you. So I work with a medical clinic known as Ubuntu Neurology. So for many years we were located in Nairobi and in the Nyanza region. So once we saw that there is a need in the Mombasa now county, we decided to extend our arms and come here in April of this year. So basically at Ubuntu Neurology, we provide neurological care for patients with neurological conditions. We've specialized in that area, meaning that we have neurologists, we have both pediatric and adult neurologists, which is advised for someone who has a neurological condition such as epilepsy to be followed up by them. So as neurophysiologists, we are a team who basically do the various tests that they are sent to do. So as we'll get on to discuss further about epilepsy, we'll get to know that there are some tests which help in diagnosis, such as the EEG. So as a neurophysiologist, we're the ones who conduct the test, give the what we've seen on the test, and that will enable now the neurologist to be able to come to a conclusion concerning the type of epilepsy. So it helps to know the type. It helps to look at the brain activity of the person, so we know it's functioning according to the person's age. That is basically what we do.
Okay.
Yes.
What is epilepsy and what causes it?
Okay. Epilepsy, described as a group of conditions, is known as a group group because there are different types of epilepsy.
Yeah.
It's just not one. So it describes a condition where an individual will have 2 or more unprovoked seizures. So what do we mean by unprovoked and having a seizure now? Unprovoked means that it was not caused by anything. That is what will make you now say this person has a seizure. And now a seizure is described as, or what people know mostly as convulsion, ama kufitika, or kuanguka, kujirusha. They are just one or more alike term describing a seizure. What happens during a seizure? In the brain, we all have electrical activity. And that electrical activity is what enables us to carry out tasks. So what happens when someone has epilepsy or is having a seizure? The person will have increased electrical activity in the brain. I'll relate it to this place here. We are having electricity now. So what can happen is the electricity can go overload. So what will happen? The fuse will go off so that it can tell you this electricity is having a problem, right? So in the brain, that's what happens. The electricity of the brain goes higher than usual, and you now have hyperexcitability, which will now lead to the person having the seizure. That is what now we call a seizure. If someone has 2 or more within 24 hours, now that is what now will make us lead to a diagnosis of epilepsy. And now epilepsy has different types. The one of the most common ones is the one enye someone now anajirusha ama kufitika or jerking. That one is the one which many people know, where I think all of us have ever seen or interacted with such a person. But we also have other different ones which are not very much known, especially in younger children. We can have a child who just stares. Maybe the child is talking to you and all of a sudden they just stop talking and they just stare. When you call them, they don't respond. Most of the time, the teacher will tell you maybe your child is not understanding things in class, or she just daydreams or just goes somewhere, and most people will not know that that is a seizure. They'll just assume mtoto akona mchezo mingi, right? Yeah, that is one of them. Some, as he described, they just drop down. They don't throw their arms or legs. They just drop down. Maybe they're just walking in the middle of the road and they'll just fall. That's also a seizure. And others, someone can just be holding a cup of tea, then unintentionally just drops it. So you might just be thinking this person is clumsy, but that person is also having a seizure. So that's what I'll describe epilepsy as in general. So if someone has one seizure, will not be, and it also depends on the cause of it. I'll go back now to younger children. Most of them can have a fever, given that their brains are still developing. Like you, you're an adult. If you have a fever right now, you can be able to tell yourself, let me just take a painkiller or a fever reliever so that I can calm it down. But in children, their brains are still developing, meaning they are more excitable than in adults. So that fever, because the brain is unable to tell it's unable to communicate that this is okay, we don't need to worry. So that fever can lead the person to have a seizure, the child now. So if we treat the fever, we don't end, we say like maybe this child just had alikuwa na homa, alafu tukatibu yo homa, the fever, it got lost, the seizure did not occur again. We won't call that as epilepsy. The person has already been treated for the febrile illness. We won't call that as now epilepsy. But let's just say after you've done all that, the fever has gone away, you treated for the bacterial infection, and the person still continues having seizures, that's when we can now take that as a diagnosis of epilepsy. That's why it's important to have good follow-up so that you cannot either be over-diagnosed or under-diagnosed, which is a common problem in our country right now, yes.
Blessed, what causes the unprovoked seizures?
Okay.
Yeah.
When we come to the causes of the unprovoked seizures now, we have various causes. The most of the time, it's unknown. You'll just wake up today, you're okay. Tomorrow, you're having seizures. You're given a diagnosis of epilepsy. We do all the tests we can do, but we can't tell you why you're having that epilepsy. That is the most common reason. So someone will tell you, I've walked. I've done all the tests. I've done those MRIs and CT scans. Nothing has been found that there's an issue. So you cannot
pinpoint that this is the cause of this?
Yes, you cannot pinpoint. And that's common for many people, actually. That forms the bulk of most of the people living with epilepsy. They were okay today. tomorrow they just started having seizures. There's also a genetic component, but it's not the only cause. In genetic, we mean that you'll go and see that the grandfather had epilepsy, maybe the father also had epilepsy, there's a cousin somewhere who is living with epilepsy, there's an aunt somewhere, but it's not the only cause, because many people assume that if you have epilepsy, that means pia kwenyu kuna watu wako na kifafa.
It's like it's
Which is not
hereditary.
yes, or genetic, but that's not the only cause. It can be, but also in Kenya, because for you to ascertain that certainly, you have to do genetic studies, which are quite expensive, and they're not even available in Kenya. We have to send samples outside, so we can't stand and say that the epilepsy is only hereditary, that you got it from your parents. We can't say that.
Is it common among kids?
Yes, very common. Actually, most people who get epilepsy, they get it from a younger age as they go, but it's not unusual to find someone even at 30 or 40 years old, because we have other causes. Let's say someone gets involved in a road traffic accident. As we've said, all of this arises from the brain, gets a brain injury in a specific area of the brain, which leads to the increased excitability of the brain. That person can end up having epilepsy just because of the impact of the accident. We also have conditions such as meningitis, which affects the brain, the covering of the brain, which is called the meninges, or any other condition that can affect the brain. That can also lead to meningitis. Even when you have a tumor or a mass, we know of children who have hydrocephalus, that can also lead to getting epilepsy. So the cause in general, we usually say most of the times we don't know. It can be caused, it can be a genetic cause, it can be post-illness, something like cerebral malaria, meningitis, having tumors or masses in the brain. Yes.
Daktari.
Yes.
Tumia neno daktari. This one inawezeka kama is it swali tu liko hapo kama haliko. Umetaja mlikuwa Kisumu.
Naam.
And then mka find need
kuja Mombasa.
Pwani.
Naam.
Kisumu is a water body.
Yes.
Large.
Yes.
Pwani
Pia.
Kuna hiyo why as in ili huko Kisumu and then need ikapatikana Pwani. What's mnaita demographic kama
what's a correlation?
Correlation demographically. Generally hatuwezi sema hivyo juu ya Kisumu ni water body and Mombasa ni water body. Kitu nyingine enye haiko tuna rely sana kwa research ya wazungu. So tunaweza sema kwamba tumenotice Mombasa kuna kifafa sana, lakini hatuna evidence, Ama we've noticed that Kisumu, you'll just go and be told like, in Nyanza, maybe in this hospital we've seen 100 patients with epilepsy in a month, but just mwezi back it up, you can't really prove that there's a correlation. Maybe that's also another gap that is lacking. So what made us come to this side, because one, in Mombasa County specifically, we don't have like a pediatric neurologist, and the centers which do the EEG, which is very helpful for patients with epilepsy, they are there, but the prices are also quite on the higher side. And so our main endeavor was just to come and offer the quality care where someone anaweza kuja aseme hapa kuna neurologist, pia anaweza fanyiwa hizi vipimo, all that in one place. So the main drive ilikuwa to hiyo, we saw the need that was there, so we decided to come.
But on the other side, Pia, but if I can relate it to the case of my sister, we'll talk of her cause for epilepsy was cerebral malaria. So in the two places, malaria cases also have been on the rise. So we cannot certainly say, as she puts it, that we have statistics of saying this number of patients have epilepsy because it has been caused by malaria, but we cannot throw out the fact that if there is a high prevalence of malaria in an area, then most probably those that end up, say, getting cerebral malaria, it might put them at the risk of getting epilepsy. It also throws to us the question of like maybe the statistics, then like what are the numbers? She has just mentioned that we really rely on information or research that has been done by other people, but at least for that which we know at the moment in the whole of Kenya, we are talking about around 1.5 million people living with one or the other type of epilepsy. And that is a research that was done way back. We have now had a lot of other predisposing factors that have really made cases of epilepsy to be on the rise. So I'm very sure if we get an opportunity to like do research again to want to know the numbers, the introduction of bodabodas, for example, you have even been to hospitals where you get to na unaambiwa hii ward near Bajaj. You see, and then when you get in there, most of the injuries from the accidents that have happened are head injuries. So they might not know, because at the end of the day, those injuries will be treated. If it's a wound, it will be treated and get healed, but it puts them also at the risk of getting what? Epilepsy later at that stage. So those are some of the things. And when we talk of bodabodas, right now we can't say that it's only Mombasa where we have a lot of them, but it is true that they have found their way into our villages, into our very remote places. So it's a means of transport that is being used by so many people. And I'm sure by the time we were talking about the statistics of 1.5, we had not really factored in these other causes that we are talking about now, like accidents through bodabodas and such.
What signs should someone look out for?
Okay. We start with the most common type, which is the jerking and the stiffening of the body. So for that, you'll find the person will just fall down and start jerking. Mostly hiyo inaitwa kufitika, ama kujirusha mwili. So, and at that time the person will not be aware, will have lost consciousness. Even if you try calling them a million times, they won't respond. Most of the times their eyes will be open, and some might be foaming or removing saliva from the mouth. So that's how you can differentiate, because someone can fall down even because out of hunger that you wouldn't say that this person had a seizure. So those are the typical. They won't be responsive, the body will be stiff and jerking, their eyes will be open most of the time, and having saliva from the mouth. For the other least common, for the others which are common in children, is like we've said, the staring or just the zoning out. It's better to be safe than sorry. If you had the tip, most of the usually comes from the teacher, because the teacher is the one who interacts with the kids most of the time. So the child will have staring or zoning out. Another sign is just the drop attacks. Someone can be walking and just falls down. You try calling them, they won't respond. And also just the clumsiness, especially in the morning. If someone just reports like, I'm only clumsy in the morning, maybe when you're making tea, you're taking your cup, the cup just suddenly drops. That is clumsiness, especially in the morning. Then most of the time after that or during the episode, you'll find that someone will either urinate on themselves or defecate on themselves, and they'll go into sleep. That's just now the brain trying to it has done a lot of work. So it's just trying to calm itself down. So that is what most people will describe to you, but it's not one fit all. That does not mean if you see a seizure and I don't fall asleep, now that means that was not a seizure. Or someone does not urinate, that does not mean it was not a seizure. Those are just some of the common ways that they present.
And when this happens, and let's say it happens in a public setup, right? Or for people who do not know, what should they do? What's the first thing that one needs to do, especially when somebody experiences? You've mentioned jacking.
Yes.
What should one do?
The first thing is we say don't panic, because mostly when it happens in the public area, you'll see people screaming or just, because just trying to create a lot of attention, then people all over time, they just around this person.
Yes.
That does not help. But at this time, this person is not aware of what is happening. So they might also actually injure themselves. So let's say, for example, in this room that we're in, if someone comes and just falls and starts jerking, they might injure themselves on the table, on the chair. So the first thing that we usually say, you remove everything that the person might get injured. So if it's in the market, you just try to move things. Don't move the person. You just try to move the things. If there's a table, if there's somewhere that the person might hit their head, because remember, we don't want to cause more harm than good. Because one of the things that usually, even when the patient comes to hospital after having a convulsion, usually have other things. Maybe the person was in the kitchen and they got burned. Some even have fractures. Maybe as they fell very hard and broke their hand.
Yes.
Yeah, so that safety is really very important. So just remove anything that might harm the person. Then after that, we have what is called now the recovery position, which actually helps for this person to not continue injuring themselves. So what we do in the recovery position, usually lie the person on their left side. The left, because the stomach is located on the left side. And one of the most common thing that can happen, so tumesema anatoa mate ama hiyo povu, anaweza kujinyonga, so it can go back because they are not aware. So they are not in control of their body. Yes, tumbo iko on the left side. Yeah,
unamlalisha upande
wa left yenye kuna tumbo. Yeah, so that at least even if the person had eaten for a sake atapike, the vomiters won't go back and choke the person, causing again more harm. Hiyo tunaita aspiration pneumonia. Iende ingie kwa mapafu, ikoste tena pneumonia. So apart from the epilepsy, you're also now dealing with pneumonia, which we don't want again. So yo unamlalisha on the left side, then you just take, if you have like a sweater or a pillow or anything that can elevate the head, the better. But unaweza chukua to the left hand and you just put it. What unataka the head equal slightly above the level of the heart, so that even as the person is choking or removing the saliva, it does not go back. Then you fall, unakunja hiyo mguu ya right, so that the person again asirudi and maintain in that place. So usually say it's good to at least stay with the person. Even if they are not aware at that time, usually just you stay with them. If it's like a child, then kumbuka si wote wanakuanga like hawako aware. There's some epilepsies mtu anaweza pata the kufitika, but the child is just still talking to you like, we call them focal seizures. It does not like focal but with retained awareness. It does not go away kabisa. So some people might actually be aware, but they are not controlling it. So you just stay with them, you reassure them, especially if it's the first time. It can be very hard also for the person. So you stay with them. Then huwa tunasema, if it's the first time happening, after that mnaezaona venye huyo mtu anaweza fika hospitalini. If it has never happened, I've never convulsed in my entire life. But kama ni mtu mwenye mnajua ni mtu wa kifafa, what tunasema, if it lasts less than 5 minutes, maybe they just had a breakthrough seizure, which is sometimes can happen hata kama kwa dawa. That one they can just note it. Si lazima akimbie hospitali then, because maybe it happened more than 5 minutes, less than 5 minutes. Wamuza kama amemeza dawa zake and all that, like it can just you can just go on with the daily activities. But if it happens more than 5 minutes, that's also worrying. Tunzakuwa tunaelekea something we call status epilepticus, which is very hard to reverse. Or analanda hata in ICU, mtu anakaa masiku. So ikianza kupita 5 minutes, if it's at home, you can start planning a way to get this person to hospital. Even if huyo mtu anajulikana ni mtu wa kifafa, muone venye atafika hospitalini, so that they can give the medicine to make it stop. So usiende kumpa, cause watu wengine pia wanaenda kupeana hiyo dawa yake hiyo wakati. It won't stop the seizure. It won't stop the seizure. There are specific medicines zenye anaweza enda hospitali adungwe that will help stop the seizures. But giving that medicine yake, assuming maybe when we give this medicine it will stop, it won't stop. And that time, don't put anything in the mouth, don't put a spoon, usieke kijiti. It might end up choking this person because they are not aware, you know, they are not controlling any movement of their body. So if you put, for example, a spoon, it might end up now choking, which causes again more harm than even the epilepsy itself. So that's
that
what I'd say.
information that she's sharing, as much as in it is good for everybody to understand, but we put more emphasis on mostly caregivers, because like this month our focus in trying to focus on the caregivers on
Yes.
what they can do and their roles.
Yeah.
So there are so many other caregivers who do not actually understand the first aid
Yes.
measures, and and it always causes a panic for all this time that we have also, for example, taken care of our sister.
Yes.
Every time she gets a seizure, and although I've said she has stayed for long, but there are things called triggers. A seizure might occur. A person has been free for a long time, but they get triggered, for example, through excitement. Like my sister, that's what triggers her seizure sometimes. You can't buy something new and show up and say, surprise. Like,
Wow.
she gets so excited, and the next thing, she gets a seizure.
Yes.
We also have people who have the photosensitive kind of epilepsy. You see
Yes.
in movies, before they start, they put a disclaimer. If you have photosensitive, where the flashlights and
Yes.
things like that can actually trigger a seizure. So this is the information that we also want caregivers to have. They should be in a place where they are able to study, know their patients well, to an extent that they can tell if something happens, then it can trigger a seizure.
Yes.
And this seizure, this is how I'm supposed to take care of it. Because in most cases, it is the seizure that puts the person in danger of, say, getting an injury like a burn or a dislocation of the hand or the leg.
Yes.
You see, just like the other day, I actually took my sister to the hospital yesterday to remove a bandage because she got a seizure and got a fracture on her leg. So most of the time it would be the seizure prones someone's to, and the goal of treatment, as Dr. will say, is to reduce the seizure so that this person has an opportunity to live a normal life without the fear of, if I step out there, I will get a seizure and I will hurt myself in one way. Yeah.
What treatments are available? Let's look at other treatment options.
Okay, for the treatment, we basically have medical treatment, where this person, depending on the type of epilepsy they have, they'll be put on medication. Most of the time, they'll have to take this medication for a long time, because epilepsy is a chronic illness, and we usually say the goal of the medicine is just to help it become manageable and to stop this seizures, because one of the things that we want to stop the seizures is because this person might injure themselves, and also if they keep on having repetitive seizures, the brain is not so forgiving. Once you've injured something in your brain, it does not heal itself. So if we have a seizure today, tomorrow, like let's say daily, we are causing more harm than good. So our goal is just to stop this person from having seizures. That's why we don't say that we are going to cure you. It's not like you'll be given medicine for 5 days and you'll be told when you take this medicine, umepona, you'll live your life. No, for most people, usually at least try to target the 2-year mark. We say that this person has been seizure free for 2 years. That's when we start at least saying if we'll think of, also depending on the type of epilepsy. For some, we start reducing the medication. For some, maybe they were on 3 medications, they start going down. If they are well managed on one, we retain on that. Then for some, they even actually go off medication but still on follow-up, because that can mean you can find someone, maybe a child at 3 years age, managed up to the age of 6, epilepsy, seizure free, then medication stopped, then they start convulsing or having a seizure again at the age of maybe 12. So the follow-up is still necessary, and it's just to insist on the caregiver and tell them we've stopped medication. That does not mean that we've cured. We've just seen they've been seizure free for 2 years. Then now we are now able to stop now the medicine, but you still need to do follow-up, so that if there is anything you note, that means the person will have to go back to the medicine again. So having that close follow-up is quite important. Apart from the medicine, we also have, though it's not yet currently in the country, there are some types of epilepsy which benefit from epileptic surgeries, where they go and take that place of the brain and just remove it, because it might help stopping the seizures, but we're not there yet as a country. Yes. So basically it's the medical treatment for now.
All right, let's look at a few comments here. Good morning, Tito. Tito says, say hi to Fred Beuchi. I remember him starting this campaign back in the days, Kule Mazeras at the time. He says he was a gospel DJ. He says that we tell you to keep doing the good job with the campaign and that he's proud of you.
Yeah,
and
thank you so much.
Yes, karibu sana. Kevin anasema kifafa kinaweza kikaisha.
Okay, hiyo term kuisha hatupendi kutumia. Ndio ni kama kusema tunaweza tibu, kifafa ni curable. Huwa tunasema kifafa ni manageable. Bora mtu ako kwa dawa, alafu kisha apati hizo episodes, hiyo kushtuka na kufitika hapati. Tunasema mtu ako seizure free, hiyo ndio lengo yetu. Lakini bado ataendelea na dawa kwa sababu watu wengi wakiacha dawa, hiyo kufitika inarudi. So hatupendi kusema inaweza isha. Tunapenda kusema inaweza kuwa manageable. Kuna wenye tukitibu unaweza ishi maisha mazuri na marefu pia. Inaweza kudhibitiwa na.
As we wrap up, Fredrick, what's your parting shot?
Mine, because the focus this month is to caregivers. We just want to encourage them. The journey of taking care of persons with epilepsy, sometimes it's not easy, and caregivers might tend to even forget about themselves, like taking care of themselves literally. Every day they wake up and they wish that, you know, the epilepsy thing will come to an end. And when they realize that this is a journey that they have to stay on for a long time, there are caregivers who get to a point where they give up. So as we have mentioned, we started the journey in Mazeras, and in Mazeras we are trying now to put up an epilepsy awareness resource center where these caregivers can be coming there, and when they feel so they feel like they cannot continue with the journey, we are there to encourage, give them counsel, and just give them a reason to continue doing their best to that patient.
All right, Blessed.
For me, I'd continue insisting and saying that epilepsy is a medical condition. It's not caused by witchcraft or something that your parents did or something that someone did to you. So, and people should realize that epilepsy is a condition that affects the brain. So anyone with a brain can get epilepsy. So that means we should extend grace to the people who are living with epilepsy, because it could happen to anyone. So that's why we need to extend grace and help reduce the stigmatization that is still currently there.
All right, thank you so much for making time today.
Thank you.
Appreciate.
We've been talking about epilepsy because November is Epilepsy Awareness Month, and I think we have learned a lot today. Yes, we've learned a lot today, and also one of the things is that what you need to do when you find yourself in such a situation, and also your role as a caregiver. From us to you, we say adios. It's been a good morning. Tutakuwa hapa kesho tena from 6 all the way to 10.
Kama kawa.
Yes. Good morning.